and on the eve of the lockdown to have our religious leaders. And thereafter we had a meeting of the African Union Bureau, which is the chairperson of the AU, which is myself, and the other deputy chairpersons being the president of the DRC, President Tshisekedi, the president of Mali, President Keita, the president of Kenya, President Kenyatta, and the outgoing chair of the AU being President Al-Sisi of Egypt. We had, as well as the African Union Commission chairperson, Chairperson Faki Mahamat. So we had a wonderful session, which I convened to enable the continent to have a clear position on dealing with COVID-19. And we found that the numbers that are affected on the African continent are rising almost every day. Their numbers have not yet reached the level at which South Africa is. We are the most affected country, but nonetheless they are rising. And we received a report from the CDC, which is the Continental Disease Control Center, which was able to give us a detailed report about the incidence of the virus in various countries. We then agreed that as a continent, we needed to approach this COVID-19 in a unified way, and agreed that no single country on the African continent should try to tackle this alone. We should have a coordinated approach. We should work together as much as we possibly can through cooperation. We should also share information about what each of us are doing, and we should heighten communication so that we know exactly what each country is doing about COVID-19. We also agreed that we need to set up regional control centers, task forces rather, so that SADC has its own task force, ECOWAS also has its own, Eastern Africa has its own, Northern Africa and Central Africa. So all the 5 regions of the continent should have their own task forces that will work together, and that our ministers of health should be in those task forces and work together. We also agreed that we needed to call on the world, particularly your more developed economies, to come to Africa's assistance from an economic point of view so that they provide stimulus, so that we are able to have the resources to support our economies, but also to allow the manufactured goods that we need from various countries, such as medical supplies, to be imported into Africa. They should not close Africa off. Lastly, and more importantly, we decided to raise a fund, the Africa Coronavirus Fund, Solidarity Fund, if you like, which will help the CDC, the Control Disease Center, but which would also help countries that are going to be in greatest need. We were able immediately to raise $17 million amongst the various countries. So Africa now